AI. Then we'll talk about some of the career indicators that are out there right now, and that are really determining the path of where you might want to get involved as a professional, and some of the ways of building these skills and knowledge in digital health. And then I have some very brief resources that I think would be really good for people to look at and just have on fingertips. So far, so good, Dinar. You can hear me all right? I can keep going?
Yes, yes, yes. We
Okay,
can hear you
perfect.
loud and clear.
Excellent. And I'm assuming the recording is happening, right?
Yes, yes.
Okay, perfect. All right. So let's talk about a little bit about who I am and why this is important to me. So, my experience has in this field is around 25 years or so in digital health in the healthcare field. My bachelor's and my master's degree is in health informatics, so information systems in healthcare. I did my bachelor's from University of Victoria here in Victoria, British Columbia in Canada, and my master's from the UK in the University of Central Lancashire. That and all focused on health informatics. My passion is about people. It's not technology, and that's really important that we understand that, because at the end of the day, healthcare is about people, right? The center of everything that we do, why we do it, why we exist, is to look after the people and make sure that they're the healthiest that they can be. Technology is on the periphery of this. Technology enables that. So it's really important for me when I think about it, is that we keep that in mind and keep that in perspective, that all of this advancement that we're doing and all of this focus and investment that we're doing as nations, as organizations, as individuals, is to ensure that we look after the people that we live with and around the world. So the people centricity is really important in the for me as my passion. My belief is also that everybody wants to do the right thing. That really helps me get out of bed in the morning, because in organizations there is no doubt you will experience, and you will experience in school, organization, wherever you are, there are difficulties in your professions, and there's difficult people in your professions, and there's politics that you have to deal with. I always take it back to the human nature. Nobody in the morning wakes up and says, I want to do a bad job at what I'm doing. That's a really a belief of mine. And it's very important for me to remind myself about that, so that I don't become cynical about the work that we're doing, because um, uh, it's a very demanding field in that way. So what I talk about when I talk about this is that people want to do the right thing. They may not have the information or knowledge to do the right thing. So they do the best that they can. That doesn't mean that everybody is like that, but majority of the people. I think it's important that we walk through life with that impact. And then if we think about it, then we look at it to say, how can I help to make things better? And how do I show up as a person? So that's really important for me as a person. And my values are the three values that have really resonated with me, have been around authenticity, so showing up exactly who I am. Trust, building trust is really important to so that you can work with the people who are around you. And empowerment, that means that people who are around you, around me, are better than how I met them. So those are really important for me personally and help me guide my path in this career. So as I've gone through this career, I've worked in the public sector, which is with the government. I've also worked in the private sector. So the Canadian healthcare system, as many of you might know, is a publicly funded healthcare. So that means everybody in Canada is covered and receives basic amount of healthcare as part of our, of us being Canadians and being part of the society. That is funded through taxes and all of those things, but the healthcare system itself is universal healthcare system. So that means is that you're always in contact with the public healthcare system, right? So that's really important to keep in mind, is that one of the driving forces behind digital health in Canada and other countries like Australia and UK and all those places is to make the system that we work in better so that it can actually be sustainable and last longer for the people who live in this country. And also become an exemplary system for other countries to look at and learn from, and vice versa. So that has been, my journey around, working from, my first job out of university was a systems analyst. I became a business analyst, I became a project manager, and then I went into consulting, did some independent consulting, came back into government, and did some work in the government after I did some consulting work, and now I'm back into consulting. So what you'll notice is that a career path is never straight. It's always going to hop around, and it is important to know that your next job possibly won't be your forever job. That's just what the market is right now, right? Like there is and you'll know a lot of people who move from here to there, or move a lot of advance in a lot of positions in the same organization, because it's a learning environment, and that is happening a lot more because there are more opportunities in the work that's happening in the digital health space. So let me get into a little bit about the evolution of digital health. And many of you will know this, but it's important that we kind of nail it down. And this comes from, from the Canadian context, and I'm sure this is around the international context also. So in the 1990s is when it all started with, digital health foundations, and we're talking about the rise of the internet, and public access to health information was becoming a big thing. And then implementation of telehealth started. And this is way back in 1990s when we look at it. In the 2000s, there was a digital expansion that was happening, which is around the popularization of e-health, the terminology e-health, growth of health informatics, and a lot of investment of dollars going into it, because organizations and governments and everybody was now trying to realize that the way the business was being run, the way healthcare was being run, was not sustainable. It was not something that could continue to go on as the changes of populations were happening. For example, people were growing older, there was more needs. So we needed to do different things in different ways to move that forward. Then there was something called the digital genesis around the early 2010s, when the electronic health records started coming out, right? So we started seeing these mega companies being formed out of really small initiatives, and that have grown to be like organizations like Epic, or Meditech, and other big EHR providers. And hospitals and healthcare systems were starting to now implement and adopt their businesses and adapt these technologies into their healthcare systems. Then came in the mid 2010s the mobile health revolution, right? So around healthcare in the palm of our hands, with mobile health apps that we're seeing, there's telemedicine that we've started to see. A lot of this was starting to happen because we got the phone, right? And now it was in our hands, and we had this whole new world that we could engage in for the healthcare and the health technology point of view. Then started coming the AI, the new frontier, which is all about artificial intelligence, transforming diagnostics and patient care. And that's where we're seeing so much development and progress happening right now in the world in this space, that is sometimes really hard to even keep abreast of or keep in touch with. And then slowly we're seeing now personalized care going mainstream. So this is, at the end of the decade, we're seeing at the 2020s around digital health is now becoming more personal, with, care plans that are unique to that person. So care plans, medication, therapy that is really designed for that individual based on the uniqueness of that person, which is very personalized. And of course, that requires a lot of data, a lot of understanding of who we're dealing with, understanding on how we deliver those services. So it's a continuous evolution. Through this stuff, one of the biggest accelerators of digital health over the last few years has been COVID, right? So I know from in the Canadian perspective and North American and UK, we were seeing things happen within days that we couldn't do for decades before. That's how fast investment and decisions were being made during COVID. Literally, there was decisions being made within one day that we had on the slate for decisions for the last 3 to 5 years, because it became a unifying force for everybody. It became something that everyone wanted to get ahead of and wanted to react to, but wanted to do it in a more coordinated manner. And technology, especially because of our distances and you know, and time zones, etc., became the way we do it. And because there was already a strongish understanding of the technology and the reasons of digital health, it was easier to build on it. That being said, one of the biggest catalysts for this was investment. The companies, especially governments and public administered healthcare systems, were able to invest money into it to enable the digitization of healthcare, right? So we saw a lot of new companies being formed, new initiatives happening, you know, things that we've never been able to do were being done. Lots of learning from lots of different countries was coming into play. And now we're in this place where, although the COVID threat is not as high as it used to be, of course it's there, but the momentum is continuing to go on digital health, because now we've said to people that this is possible, right? So now they've tasted it. It's very hard to go back. So there's this constant struggle now that, you know, public organizations are having, especially, is how do we continue this momentum while managing investment in this? And that we cannot now go back to the way we used to do things, because that is not going to fly anymore with people, right? So there's this constant pressure of innovation and what people want that's pushing it forward, but also bureaucratic resistance that's happening in the system, right? So we're seeing this kind of play out. And as new things are evolving, the regulators, as well as the funders, as well as healthcare providers, practitioners, are now forced to react. So the success happens when that forcing is actually proactive, right? Like when we start seeing what's happening and we start to adjust our organizations and systems to move through that maze. And that's where some organizations are going, some are struggling. So it's a really interesting, diverse landscape right now of where things are at, from place of adoption and place of where people are wanting to go and where organizations are going to go. All right. So if you're ever looking for a definition of digital health, I've been looking for years. And one time in a presentation, there's an individual called Dr. Ann Snowden, who works for the Health Information Management Society, HIMSS, has coined a definition that has really resonated with me. So I'd like to read that to you, and then I've highlighted some parts. So digital health connects and empowers people and populations. Remember, first thing I talked about was people, right? It's not talking about technology, it's about people. To manage health and wellness, augmented by accessible, supportive provider teams. So people serving those people, so provider teams, working within flexible and integrated, interoperable, digitally enabled environments that strategically leverage digital tools and technologies and services to transform healthcare delivery. When you think about digital health, first mind would be that the definition is flipped, right? Like it would be like technology driving the healthcare delivery. No, it is how we use and strategically use technology to enable healthcare for the teams that are serving the people. So it's like a circle, right? So this is what patient-centric care means, right? Patient in the center, then there's teams around them, and then there's technology that's enabling it. So that's how I view it, and this is one of the definitions that's really resonated with me, to say it really puts digital health in its place on how it exists within the healthcare system. Down the line, the hope is that the word digital will fall off, right? Because there's no healthcare environment, doesn't matter where you are, in rural or in remote areas, or in urban settings, there is very little areas of healthcare where there isn't some sort of technology being used, right? So it's really interesting that now healthcare delivery and technology are so intertwined that they become part of each other, right? And that's where the evolution is happening. So that begs the questions, like, what is happening in the digital health space? Like, where are things going? What are some of the main topics that are being discussed? And this is, again, based on what I've read, I've understood, what I'm seeing. So there is this drive for instant access to care, which also is known as virtual care, or whatever you want to call it. And that's the Uberization of healthcare, right? So it's like, when I want service, I have it, right? So being able to go see a doctor without going, or a nurse practitioner without going into the office, and being able to see them when you want to see them, based on your convenience, right? This was the biggest shift that we were able to do during COVID around the world, right? Because in Canada, for example, all the, like, at least in the province of British Columbia, all the physician offices were closed down for physical contact. You couldn't go into a clinic, but patients still need to be seen, right? So this very quick evolution and enablement of how do we use technology that we've got to give virtual care, and then that's now evolved into, why do I have to go now? Like, we know we can do this. Why do I have to go to the clinic? Why can't I just do virtual care? So, for example, I'm pretty lucky to have a family physician. There's a shortage of family physicians in Canada, and every province and territory in Canada is working towards, bringing family physicians in, because there's a huge shortage of it. So, for example, the province of British Columbia is about 4 or 5 million people. 1 million of them, or just over 1 million, don't have a family physician, right? Which is a really big chunk of the population. So, now people want to be able to see providers whenever they want to see it, and that has now become a practice in family care. So, for example, my physician, the first option is, let's have a virtual consultation before you have to come into the office. And if it's something that feels like, okay, you need to come into the office, then that's a secondary visit, right? So what that does is it really puts things into perspective to say, if this is something that can be handled virtually, let's handle it virtually, or bring the person in if they need to come in, because of course exposure to things and all of those things increases when you're traveling and going into a healthcare facility. Mental wellness unlocked. So mental health across the world has become very a dominant discussion that's now openly being talked about. It's always been around, right? Like, we've always had mental health concerns that are going on in the population. Now we're talking about it more. So, mental health, the talking and really making it a mainstream topic has also been a side effect of COVID, right? So what mental health was being called was an echo pandemic. So an echo of COVID, because of the isolation, because of people trying to figure out, how do we live in this space, mental health issues and mental health things started to become more visible, right? And we're seeing impacts of that in our families, with our friends, professionals, wherever. It's not something that we don't talk about. So one of the things that we're seeing here on North America is that conversation is really moving forward, and services and technology is now being made available to handle and work with people to enable better mental health care. Seniors health empowerment. One of the driving forces of thinking about healthcare differently has been the aging population. People are living longer, which is great, and also it puts pressure on the healthcare system, especially when you don't have enough people serving the people, right? So how do we now make sure that digitally we can enable seniors health empowerment? Women's health empowerment. is femtech, what it's called, and in lots of different words, is about technology that, and including, this includes products, services, diagnostics, and software addressing the wellness concerns specifically for females, because they have been overlooked for years and years, right? All of the stuff, majority of the research or research who's is being done by in the past and continues now has been through by males. So there is a lack of understanding of how women's health plays a part into this, who are majority of the population, right? So there is this empowerment of how do we make women's health more accessible and enable that through conversations. So that's a really big emerging topic. And one of the things in North America that is being talked about a lot is around creating a health hub that is close to your home or in your home. So what's being categorized as aging at home. So we don't want people coming into the hospital as they age, right? We don't want people going into retirement facilities as they age, because one, it's not going to be comfortable for them as people because they want to be in a familiar environment. And two, the infrastructure cannot support it, right? So there's this whole drive and push to move living and transform living spaces into care environments where people can live in their home and also have technology and services that are available to them that can help them move forward and live a healthy, long life. And the last one that I'm seeing, and this is probably the most important one, is equity in digital health. So what this is doing right now, and I've seen it happen in my community here, is that it's creating a digital divide, right? So if you here's the example that I use all the time. As I said, in the province of British Columbia, the clinics shut down. There is rural and remote areas, mountainous regions within British Columbia, right? Where very small populations live in very rural and remote areas and don't have access to healthcare on a good day, right? So, the clinic might open once every 2 weeks there, or once a week there, or, the drive to get to a clinic is 3 hours if the weather is good, right? Like as you go north in Canada, there's a lot of snowfall, nothing different than Chitral and places like that. There is a very different weather as we go from south to north. So imagine if you're in a community like that, and during COVID, the only access to healthcare providers you had was through this clinic that would happen on like an intermittent basis, and that gets shut down. So now you have no access to healthcare. And on top of that, the urban areas are now going digital. So they're providing virtual care, right? But in the rural and remote areas, it's the same problems. There is no connectivity. Internet, phone, that's not widespread because those areas are rural and remote, and there's investments that are required to bring infrastructure there, right? So what did we just do? We just created a bigger digital divide. We doubled down on a digital divide that already existed and now connected health to it, right? So now the conversation is going around the digital determinants of health, right? So technology becoming a really big part of providing healthcare, and not forgetting people who live in rural and remote areas, or areas where technology might not be available, or age groups that technology might not be accessible, or populations who are unable to engage with technology due to disabilities. All of that stuff now is coming into the conversation of equity in digital health, so that we don't forget people just because they don't look like us or behave like us. We don't forget them, and we bring their perspective into what we're doing and developing so that we can do a better job. And that goes back to humans being the most important aspect of digital health, right? Patient centricity, understanding who you're serving, and then creating technology or processes or services to service those people who actually need it. So that means we need to know who we're serving. All right. there's a couple of things that are really important to me, and I'll talk about it. And this is the reason I talk about it is because it shows the current state from my perspective, what I'm seeing, and I want you to know as we talk about the context of digital health of how some of the challenges you're going to see. This is what the current state, I would say, looks like of innovation in the healthcare. And I explain it this way. I say there's islands of really good ideas in a sea of really bad ideas and implementation. Okay, so there's just so much momentum in digital health that there's so much investment and so much passion about it that everybody's doing something, right? You're seeing these startups pop up solving problems, and not all of these are good ideas. Not all of these are good implementations. Not all of these are viable. They're important to learn from, but not everything is going to be successful. But there are really good pockets of success that has happened. And those are islands of innovation, as I call them islands of innovation. So as professionals in this field, doesn't matter if you're in digital, like technology side or healthcare provision side, what my vision and our vision should be is to create connections between those islands of innovation, right? We don't need to do things over and over again and learn on our own. That's not how human beings work. We work through working together, right? But that means we need to put our egos aside, right? And really focus on the work, really focus on what's important and how do we move this forward. So there's this aspect of service, khidmat, right? That's always attached to the healthcare sector, which doesn't change when you're working in digital health, okay? The other thing that's really important that I've seen happens is that there is a lot of investment happening in technology. And we're seeing this in like organizations like AKU, like hospitals around, like there's technology being brought in, right? There's digital transformation that's happening. And what happens in many organizations is that a really itty-bitty part that is very foundational gets forgotten, right? And that's the culture. Culture of the organization has to also evolve with digital transformation, right? So we cannot, what we're not doing is replacing paper with a computer. That's not digital transformation, right? Pencil and paper are also tools. So we could say we're already enabled, right? But what we're doing is bringing in technology to enable the delivery of healthcare. And that requires really difficult conversations. That requires conversations around, is our culture really primed for this transformation? Are people ready for this? Are we going to get pushback, right? So what we see in a typical organization is that there is cooperation that happens, right? There's people have mutual respect for each other. They have transparency. They talk about what they want to do. They have shared goals. We want to implement this EHR. They've got like independent and dependence going on. There's loose networks of people attached. There's sharing of ideas as a group, and there's engagement. But in digital transformation, to make sure that culture block is looked after, cooperation is just table stakes. It's basic. We need to start there. But where we need to go is collaboration, right? What collaboration does is that there's mutual trust amongst organization. So imagine, right? Like when you're talking to IT or when you're talking to like one department or other, is there trust that what they're saying or what you're hearing from them is you believe it? Is there trust that, this department is really looking after what you need and you're looking after what they need? Is there trust that, what we're trying to do and invest in and the strategic priorities of the organization we believe in, right? There's lots of different levels of trust, but it comes down to humans again, right? There is vulnerability to say, you know what, we screwed up, right? Failures are not bad. Mistakes happen. Environments need to be created to make mistakes and do it, but fix it quickly and realize it. And what that means is that we have to admit that we made a mistake, right? So that's really important as we think about digital transformation. There's a shared vision and values, not just vision, but values. How are we going to make decisions? What's important to us? Are the people most important, the patients, or is it the care provider? Is it saving money? Is it, making sure that we're the hottest organization around in the world? What's important? Let's put it on the table and go double down on it, right? What are our values? There's constant state of interdependence. If somebody does something here, it's going to affect you here. And that happens in digital transformation because data is going to be the lifeblood of the organization. And anybody who does anything with the data is going to affect everybody, right? That's just a very basic example. But that also exists with people. It's a very tight culture that you need that's like really aligned to the goals, as well as really long-term thinking. And of course, there's empowerment. It has to be, not everybody that we're going to deal with in an organization is going to be at the same level of understanding or education or passion. But we can't leave people behind. We can't. We cannot succeed if we don't empower people around us and empower ourselves to do the right things, right? So as you see, technology right now can solve any problem that we want it to solve. Technology solving problems is not the issue. It's how do we bring it in so that it becomes sustainable, so that we can actually see the changes that we want to see that are not short-term, but long-term, and actually enhance the culture and develop the culture of the organization. That's where I come from digital health. Like it's about people and how do we make it better. All right, I'm gonna go a little bit faster now. I know we've got about 20 minutes left. I want to leave a little bit of time for questions. We've talked about a few things. Now I'm going to talk about, I just want people to understand where things fall, right? So there's a lot of buzzwords going on in AI, machine language, natural language processing, generative AI. So here's how it lines up. Artificial intelligence is the broadest concept, refers to systems that perform tasks requiring human intelligence, right? Humans could do this. And that includes like reasoning, learning, perception, problem solving, and language understanding. That's basic AI. Machine learning is all about, it's a subset of AI and focused on machines learning from data to identify patterns and make decisions, improving over time, right? And being explicitly programmed to do that. So improves over time. Natural language processing is a subset of AI that deals with the interaction between computers and humans, right? Using natural language. So how we speak, ChatGPT, right? Like you can type whatever you want the way you speak, and it comes back with something that you might want. And this is enabling computers to understand, interpret, generate human language, right? So that we can interact with it. And then there's generative AI, which is a subset of AI specialized in creating new content based on learned data patterns applicable in art, music, design, content creation. And we're seeing like bursting all over the world right now. So the reason I put this out there is because there has been a lot of conversation around it, and people use these terms very loosely sometimes. So it's important that we ground ourselves to say, what is it, right? So hopefully this will help. And why are these top of mind? Like, why are these things that like AI and all of these things top of mind? Well, it's important because organizations and people are trying to transform day-to-day operations by automating routine tasks to reduce error, frees up staff. You can use people for more creative and strategic things. It also enables data-driven decisions, right? So it's not like I believe this is what it is. It's actually, you see the data to say, what I believe is wrong, but the data is actually telling me this, so we got to do this, right? So it's like, it's actually enabling us to make better decisions. It's also enhancing patient interactions. So, for example, one of the things that happened a lot in lots of countries or during COVID was this robo chats started coming up, right? Like, so for example, there was symptom checkers that were coming up all over the place, or there were things that people could type into to just get some sort of healthcare services very quickly through this interaction with AI. Really took away pressure from phone calls like emergency calls or nurse at home or doctor at home calls. And and the other thing that's happening is that we have so much data in healthcare that we just collect for the sake of collecting, that people don't understand why we're collecting and how this actually connects with each other. So there's a lot of unstructured data that exists in healthcare. And what that means is that we need some way of ensuring that we can understand that data so that we can see where this data is pointing to, and we can make better decisions and take the healthcare sector forward. Of course, the benefits of this is there's increased efficiencies, there's cost reduction, there's enhanced decision-making, and there's patient centricity, right? At the end of the day, we're utilizing data to provide personalized services, insights, and care for patients. What are the challenges? Challenges around this AI and other technologies is around privacy. One of the things that is really big right now is around ensuring the privacy and security of secure data is maintained, managed, and the trust is there between the user and the provider to make sure that the data is not going to be going somewhere where it doesn't belong or being used in a way that it doesn't, it shouldn't be used. There's data security. We're seeing a lot of, ransomware stuff happening in the healthcare facilities and the healthcare organizations and all the other places. So how do we protect data from unauthorized user and cyber attacks? There's initial investment cost. Implementing AI systems can be very costly, but the return on investment can be very significant over time. So there is this injection of cost and skill that's required. There's data management and quality. So it's simply put, garbage in, garbage out, right? Like, so if something is so driven through data, but we're not keeping, track of how we're collecting the data, or if the data is good or clean or not, whatever decisions we're going to make is going to be on bad data. And that's really, needless to say, not the intention of AI or any sort of data analytics. So what doesn't go away is the focus on making sure our house is clean and making sure that our data is clean before we make decisions and use that data to move forward. One of the biggest gaps and the challenges right now is the skill gap. The technology is moving so fast that it's outpacing right now the current workforce's ability to adapt, and organizations can't keep up, right? And so it's now creating this gap of knowledge and ability in this space, which is also an opportunity. All right, we've talked about a few things, and I want to end with talking about some indicators of where careers are going in the digital health space. So digital health will continue to be around, and you'll see this more and more. It's going to get personalized more. So we're going to start talking about improving well-being, which is enhancing patient well-being and showing visible results. We're not in the place where we can ask for investments and things like that to say, oh, I have an idea, I think this will be good. Now investors and systems are looking for ideas and products that will enable well-being and are actually showing results, right? So proven things that will be picked up and will be easy to implement. There's a competitive edge aspect that's happening in the career space, which is around keeping pace with the technological advancements is very crucial. Making sure that you understand the concepts. You don't have to be an expert in everything, but you need to know enough about it to have a conversation, or to know that I'm interested in this a bit more. So that means you have to cast your net wide, right? That's what we have to do. I do this, I try to do it. It's hard, but we have to do it in order to be, make sure that we're keeping an eye on what does the horizon look like. There's an economic impact. So we know that, the digital health ecosystem is expected to generate substantial economic impact. A lot of the technology and the things that exist now didn't exist even 2 years ago. And we're seeing the impact of it. And you're seeing that in Pakistan. It's happening all over the world. There's these services that are being available, technology being available that is now getting implemented, and it's creating a positive impact on the economy, which is great. There is the patient journey integration that's really important. So success in digital health, like I said, hinges on making sure we're looking after the patient. And what that means is that understanding what a patient journey looks like. So what a patient journey is, that from the moment that they come into a facility, what does this journey look like for them, and how is technology going to enable that? Or if they've just been diagnosed with a chronic illness, what is their patient journey going to look like through this chronic illness, and how can we make sure that we understand all the areas, and how do we find the right places for technology to help manage those chronic illnesses? Or if there are, other illnesses that have come up, critical illnesses, how do we manage that, and how do we help the patient be empowered to handle that through technology, as well as delivery of services that they will see in healthcare facilities? And there's a culture and strategic shift that is happening, and very, very important is that there's a cultural transformation that's happening in organizations driven through this. And some organizations are doing it really well, and some organizations are not, right? So knowing how to add to that conversation as a professional is going to be really important. Where the driving forces of jobs and things will be, from what I'm seeing, is around big tech, healthcare providers, and startups. They're going to be the key drivers of the change and the transformation. But what needs to also happen is that the biggest focuses need to actually be driven through the patient voice, right? What is it that the patient is looking for? You can give them the best technology that you've developed, but if they don't find a need for it, they're not going to use it. So really understanding what is needed, and then doubling down on that to make sure that we make people's life easier and push the boundaries and transform organizations around. Collaboration and sourcing has been a really big conversation around what's happening. So for example, what's the front end facing aspects of a technology? Organizations are trying to build it themselves. And what's the back end stuff? Organizations are collaborating and outsourcing technological backgrounds, right? So, and these things are not something that are based on opinions. These items are from an organization called McKinsey, where they're seeing that these are the career indicators that are happening in digital health. So what do we do and take that, and how do we build ourselves up for that sector that's now being evolved? So here's the 5 things that I think are really important. Is you have to focus on professional advancement, which is professional development, right? So thinking about education and health informatics, looking at data analytics, change management, right? Business analysis, product management, project management. Those are things that have to exist in order for technology to exist, right? Those are enabling careers. There's technology and skills innovation. So, technical skills in data science and app development is always good. And really using areas where, things like hackathons or incubators or, opportunities like that, where you can use and learn from other people. So collaboration in such environments. There's clinical engagement. One of the advice that I give to any new grad or anybody in the career is that if you want to really help solve problems, you have to understand what the problems are. And that can only happen when you've been immersed in the environment. So I encourage people to work in areas where they can experience the healthcare settings, where they can actually see it and feel it themselves. That might be through what they call lived experience, right? Like that you're a patient and you've gone through it and you're like, God, this shouldn't work this way. It needs to be better. Or you're in the environment and you see where things can be better. There has to be a user-centric focus. So, building trust and meeting customers effectively. So understanding, when technology comes in, does it actually meet the doctor's needs? Does it meet the nurse's needs? Does it meet other health providers' needs? Does it meet the patient's needs? We need to understand that. Excuse me. And the last thing that's really important is networking, right? So events like this, getting to know people, creating a network of people that you can work with, you have trust with, so you can remain involved and informed about what's happening in digital health. And this can be done through in-person things. This can be done through, Zoom sessions. This can be done through LinkedIn. Very powerful tool to stay connected and network. So lots of different things that are available, but we need to get to know people and get to know them personally so that we can help them and they can help us. I'll leave you with this. The most important thing about digital health is hope. And in everything that we deal with right now, hope is really important. And the reason it is that, I believe that the healthcare transformation will continue to be the focus. There are opportunities for everybody in this space. There's only progress through collaboration. Competition doesn't work. We have to collaborate and work together. And empowerment through technology is really important. So not thinking that technology is the solution, it's actually how we use the technology and empower the people and patients and providers is going to be the key. I will leave you with some resources. Take a screenshot of this or it will be recorded. There's some, really key things that I think, if you're interested in digital health or you're immersed in it already, you should look at. So there's new ethics and governance of artificial intelligence for health guidelines that have just come out from World Health Organization, very important. There's Canada Health Infoway. Think about, if you want to know what's happening in Canada. There's Australian Digital Health Agency. There's Estonia eHealth. Estonia is completely paperless country. Then of course there's AKDN resources, right? So there's the digital health program and as well as the digital health resource center. With that, I will leave you with this, who I am, and I know we don't have a lot of time, but I'm happy to answer any questions that that you might have.
Yes. Thank you very much, Zen. Very thoughtful, insightful, and very in-depth analysis of your area of expertise. I mean, yeah, it is going to be very fruitful for youngsters and professionals who are looking into digital healthcare. So we do not have much of time, but a few questions. So I would ask the participant if any one of you are interested to have a conversation with Zen, can reach out to him on LinkedIn, or you can contact me. I can get to him as well. But before that, if you want to ask question right now, you can please come up the mic and you can ask. If you are not comfortable with that, you can send your question on the chat. So then there is a question. So let me read it to you. Yeah, Mazhar. So this is the question from Mazhar. He's asking how the implementation of bioinformatic technology will reduce the economic burden on people with respect to common man. So what's your take on that?
That's a very good question. It all depends on the country and the context that you're living in, right? So for example, if I look at from the perspective of publicly funded healthcare systems, it will impact the economic thing for us. It's because we're going to get more bang for our buck, right? Like, so for the taxes and all the contribution that the citizens make, you're getting more services, more enhanced services, more efficient services. The way that the private side of things that are talked about is that it's all about reducing cost for the organization. And if the organization is really talking about, equity in healthcare, right? I'm not talking about digital health equity, but equity in healthcare, then what that means is that the efficiencies and the economic positivity that we're seeing actually gets translated and transferred to that person who's that patient, right? So the intention is, if we were living in a place where, we're saying that, okay, we have seen these kind of things and we've reduced our costs, how do we pass on this reduction of cost to the patients, right? So that now more people can afford better health. That comes down, my friend, to values of the organization and the environment, right? Do we value the humans or do we value something else more? It's not an easy question, and it's not a very, a black and white question here, right? So it is all about what is the value, what are the values of the organization or the environment that we're in, to say that we need to be able to, give back to the community. And one of the things we can do is through transformation and digital transformation so that we can reduce costs and then pass that over so that more people can have access to costs, or reinvest it in the organization and make services available to communities in rural, remote, and other areas where services cannot be afforded or delivered, and we actually do that through our networks, right? So that's how I would see it's like down the line, how, but it all comes down to the strategic direction and values of an organization.
Yeah, so there is another question, somehow you have addressed that as well. The question is from Tanzil, is asking how we can bring equity in digital health. So yeah, you talked about it, but if you can elaborate a little bit that.
So I would say one of the things, the equity has to come through patient experience. So we cannot forget that anything that we're designing or we're building is to serve the patients within the organizations or across the country, right? So the only way we do that is through inviting the patients into the conversation and understanding what they need. We can't sit in a white, tall tower and say, well, I think you need this and that. And then when it doesn't work, you're like, well, why isn't it working? Well, we didn't design things that were making it equitable. So for example, it may be that somebody requires just access to infrastructure, right? To make sure that there's cellular waves coming to the area before anything can happen, right? So that might be one of those things that we say, okay, let's double down on the infrastructure development so that we can then make positive impacts through technology, right? There's no sense in giving somebody access to cell phones when there might not be any value to them, right? So, but we won't understand that if we don't understand the person or the communities that we're trying to deal with. So the way, in my mind, to engage and ensure equity is that to hear the voices from different people and understanding it and knowing that there's going to be competing things, right? So the magic comes into, and diversity is strength. We've heard that many times, right? Diversity and pluralism is really important because it teaches us how do we find creative solutions to make sure that majority of the people or as many of the people can be satisfied. But the only way we do that is when we invite people to have that conversation. So invitation of people sharing their lived experiences. Nobody who, only the person who's living through cancer or any of those things, they're the only best people to tell you what it's like going through it. We cannot imagine it unless we've gone through it, right? So that's important to create that ability to share that voice and then taking that into account and then moving things forward.
Yeah. So there is a question from Nazia. She's asking, basically, she's not into directly in the healthcare, but indirectly is her area of interest is economics and data. So people like her, what do you think? What are the opportunities for them in this age of high tech, artificial intelligence, things like that?
Nazia, I think you are in a really good spot if this is your interest and if you really like it, because if I'm looking at like AKU bringing in technology, I think they've got the EHR implementation happening. There's so much work happening. What's going to be next, or should actually be happening right now, and I'm hoping it is that understanding what type of data is required. How do we understand the data that we're actually capturing, right? And what kind of tools are there to enable such data analytics, right? So I think you're really in the space where you need to be if this is what interests you, right? And what I would say is get more experience in different types of tools, different types of visualization tools, different types of ways of even talking about why data is important, because not everybody around the table will understand how to consume data and how to make sense of it. So your job will really become is that I understand this complicated things. I understand the business problem that you're trying to solve. And now let's bring it together and I can show you. And how do we actually monitor our success? That's what is really driving a lot of these conversations, is to say, what can we do to provide the right data at the right time to the right people so that they know the right decisions to make, and also that the decisions that they've made are right? So that they can actually pivot and make changes as quickly as possible, right? So I think you are really in the right spot. I would say just make sure that you continue to keep the people aspect and the change management aspect in mind, as well as really get good at explaining why such things are important, and why data is important, and how what technology is out there to make data more accessible and visible to people.
Yeah. So then I was listening to Albert Bourla in the recent World Economic Forum that happened at Davos. He was saying is the COVID pill which Pfizer formulated, it took them just 4 months while using this big data, artificial intelligence, things like that. So that's the pace of innovation. So if they are supposed to do it in traditional way, it would have taken them 15 to 20 years. So considering the amount of innovation, the advancement that's taking place in the health sector, how do you see what are the things which these youngsters are supposed to do, and what are the things which they are not supposed to do? What's your take on that?
Sorry, I didn't get the last part of your question. It broke up a little bit.
Yeah, so considering the rapid innovation that's taking place almost in every sphere of industry, particularly in the health sector, digital health we're talking about. So my question on behalf of these youngsters, particularly students, is what are the skill set which they should be more focused on, and what are the things which they should not be more focused on? Yeah.
Yeah, so I would say is like, I think being a learner is really important, right?
Okay.
Like, and understanding, because there's just so much interesting. I go through this all the time. There's so much interesting stuff happening that I want to do everything, but that's not possible, right? So really understanding and getting a really idea of what's out there, what is happening, and what interests you, and then going deep in it and understanding it. And that happens through education, that happens through connecting with people who are doing stuff. One of the biggest things that I would suggest people do is reach out to people who are doing things that they would like to do, and ask them, 5 questions about what they love about their profession, what they don't like, what they wish they would have done differently, what education do they think they need to have, and what's some advice or other people that people can talk to. There's some really key questions and networking that you can use to learn more. There are, and I say this to a lot of people, especially people who are migrating to Canada and other places, is that we have this mental state of, taking up any opportunity that comes to us because we're afraid that opportunity is not going to be there if you don't take it. We can't work through that right? Like we have to be really, our time is really important. Our energy and health is really important. Not every door needs to be walked through, right? But the only way you will know which door to walk through is if you know a little bit more about yourself, on what you're interested in and what type of people you want to work with, what type of profession you want to have. So reflect on that. Do your research, talk to people, and then when opportunities come, we are more aware and more educated in which opportunity we want to take, right? So just like, it doesn't have to be, there's this term that, there's this phrase that say, it's not a sprint, it's a marathon, right? So the career and life is not about running fast and getting there fast. It's about how do we sustain this so that we can actually progress and continue and sustain our energy, our knowledge, and continue to make changes in the healthcare sector.
Yeah. So then the last question, but certainly not the least one, is when these digital doctors are coming up, what do you say?
Pardon, I didn't get that one, Dinar.
So you see, there's the education because of this advancement in technology, the education has been democratized. So is the health sector. So we see this chatbot like San Vigo, which is a kind of personal tutor for every student. So what do you think? What is the comparable of San Vigo in the health sector? So where are we going to witness the digital doctors?
I honestly think you will, right? Like, I think it's actually going to happen, and it won't happen. So it won't solve. Here's the thing. It won't be something that will replace everything, but there will be things that will be replaced, right? And that doesn't mean that people will be replaced. It just means that people will provide better and different services. So there are things that will happen, and we've seen that, like through these chatbots, like you're saying, like, like symptom checkers and this kind of stuff. I think it's going to get better and better and better, and it's going to happen. So one of the things that's I just heard about in a hospital in British Columbia here, they have now got, I think, 110 or so. No, I don't know what number it is, but robots actually doing specimen collection and specimen processing in the labs, right? Because it's repetitive work, and they're doing it faster and better. And that means that all the other people who were doing that are now doing interpretations and doing a higher skilled job and actually using more interesting things. So it's just such a really interesting evolution of stuff. And it's going to continue. And the only way we can, succeed through is if we do it together. There is no other way but to just do it together in a collaborative manner.
Yeah, yeah. So we have Forum is leading our efforts, including the digital outreach which we are doing. Forum, do you want to say something? Any question? Any yeah, you want to say something, please do before we let go, Zain.
Thank you, Dinar. Thank you, Zen. Zen, I listened to your talk. Absolute pleasure. And first of all, I would like to thank you for taking time out and giving us an opportunity to interact with our students. I think nothing really. This has been a fabulous talk, and I really like the perspective of putting the onus on people, or really thinking about people first when we think about digital strategies, and not really think about technology. I think a lot of times we make a mistake when we tend to think more on the technology side and less on people. And I think what Zen has been able to really focus on is to put center back on the people, spotlight back on the people. So no, fascinating talk, and thank you so much for taking time out. Really appreciate it, Zen.
Oh, my pleasure, Karam. Thank you. And Dinar, thank you for reaching out. And, I'm always happy, like if there's another session on a certain topic we want to do, I'm more than happy to do that. I think, and thank you, Karam, for doing really good work. And I'm really excited about where things are going.
Thank you very much. Thank you very much, Zen. Thank you for doing this. And surely we will be reaching out to you for other things. And for now, thank you very much for your time, and God bless you.